Hi, my name is Dr. Kai-Ping Wang. I'm Chief Medical Officer of High Focus Centers. I'm here to talk to you today about safety planning, which can be an important part of mental health treatment. Now, safety planning is usually invoked whenever there is a risk of suicidal thoughts, so it's trying to mitigate that risk. But it can be helpful in other situations, such as self-injurious behavior, substance use, symptoms of eating disorder like binging or purging, explosive anger, or really anywhere else that there can be intense emotion that may cloud our judgment and reason and can lead us to do unhealthy or even dangerous activities. Now, a typical safety plan has several components, and I'll go into each of these throughout the rest of this presentation. It's important to note that safety plans are probably best done with the help of a counselor, a therapist, or other qualified mental health professional. Now, the first step you want to take is to identify triggers and warning signs. And this can be certain situations or places. It could be specific people or relationships. It could be about what people say. Sometimes time, like time of the week, time of the year, can be a trigger, especially if it's an anniversary of a past loss or trauma. Warning signs can consist of specific thoughts, such as, oh, I'm worthless, I'm a hopeless human being, there's nothing that's going to change for me, no one loves me. Those can be warning signs of dangerous kind of thoughts. And specific behaviors may also pose as warning signs, like withdrawal, isolation, maybe engaging in emotional eating, or decreased personal hygiene. The next part of creating an effective safety plan is to make sure your environment is safe. And typically this means reducing access to lethal means, like firearms or knives. But you may also want to secure medications in case of possible overdose. You want to remove or limit access to alcohol or other illicit drugs, because often under the influence, we may be more likely to engage in unhealthy or dangerous behaviors. Now, this first part is about developing personal coping skills, coping strategies, things that you don't need to rely on anyone else to do. And it could be pretty straightforward, like going for a walk, engaging in physical activity or exercise, spending time with a pet, really getting involved or engaged in a hobby or interest, like creating something or practicing something, listening to music, meditation, even affirmations, or reviewing why your life is valuable and reasons to live. So there's a wide range of things that you can engage in as personal coping skills. Engaging in social interactions is important. By and large, most of us are social creatures. Even the most introverted of us does get something out of one-to-one relationships. So in terms of these social interactions, it doesn't have to be about sharing specific thoughts about suicide or anything else. It's more about engaging in people socially, which can serve as a helpful distraction. And also there's a general sense of emotional support. When you're with other people, you can feel involved, you don't feel as isolated or lonely. So even just their presence can be helpful to you. And this can also include just healthy social settings when you're around other people, like a park or cafe or maybe even a library. Now, the next level is to seek help from close family and friends. So these are individuals where you can share some of these more intense or upsetting thoughts or thoughts about suicide. I would suggest trying to involve these individuals early on in creating this part of the safety plan. And this way you can let them know what kind of things they do that are going to be most helpful for you. So you can give them specific instructions as to what to say, how to intervene, as all part of this safety plan that you're creating. Now, the step beyond that is to contact professionals, like calling your therapist or other mental health professional, like a counselor or your psychiatrist. Maybe reaching out to certain local agencies. There are several 24-hour, 7-day-a-week hotlines that you can call for suicide, substance use, eating disorder, and so forth. And the ultimate step you may need to take is to contact emergency services. Maybe go to the local emergency room if safety is a big concern. Now, after you create all this plan, it's important to look it over carefully and see if there's any barriers. And what I mean by that, are there things that could throw off some of your coping skills or strategies? You want to develop some contingencies if someone's not available or if someone kind of responds in a way that isn't so helpful. This is definitely an area where working with therapists can be helpful in fleshing out or identifying barriers and figuring ways to deal with those barriers. Now, for parents that are dealing with children that are struggling with mental illness, I do suggest trying to take a more collaborative approach with your child and kind of create this plan together. You want to ask your child what kind of things that you do that are helpful or harmful. You know, sometimes as a parent, we may say things in a certain way or express things in a certain way that can come across as unintentionally critical or judgmental, and then that can kind of shut that dialogue down. As a parent, I think it's also very important that we're aware of our own emotions and feelings. For instance, when my kids were young, they ran across a really busy street and almost got hit by a car. Now, I yelled at them. You know, I started to make them cry. But I was really just scared and frightened. But I'm sure they heard that as me being mad at them, me being angry at them, which was not the point at all. So this is something that's always good to keep in mind, to kind of be aware and insightful as to what oneself is going through, because that can translate in how effectively you communicate with your child. Now, safety plans often kind of come with something called a contract. And the contract is really talking more about committing to a certain course of action, committing to taking steps to make sure that they're safe. So being part of that treatment. And so High Focus does have a safety plan and contract that we use in specific cases. These are some resources and hotlines that may be helpful. And definitely you want to include these on your safety plan as part of that contact professional step. Now, hopefully this has been helpful in understanding what a safety plan is and how it can be helpful for mental health treatment. Thank you for listening.